In our previous e-lesson, we explored the topic of regulation and how it develops in children. We also explored the fact that young children are designed to learn self-regulation by first being regulated externally by a caring adult, then by co-regulating with the guidance of that adult, and then ultimately gaining capacity to self-regulate. The tragedy for children who've come from hard places is that in the absence of tender care during the first forming years of life, a child of any age will fail to have the capacity to self-regulate if it's not been learned. Remember from the attachment cycle that there's a behavioral system of trust that is carried in the relationship between the adult and the child. There is a biological system of sympathetic parasympathetic balance that is established, and there's also a neurochemical balance that is established given the basis of care, ongoing care, by a safe, caring adult. The purpose of this lesson is to illustrate a number of activities that can help children learn to be self-aware and then to regulate. You'll see that in these clips, very frequently there are still many signs of co-regulation and even sometimes external regulation. But ultimately, we see in our environments very quickly children learning to recognize their emotional states and then gaining capacity to be partners with us in their own regulation. In the first clip, you'll see an example from our sensory room. There's a child in this clip who was from hard places. He was drug and alcohol exposed and then was harmed as a little one. He did not learn to self-regulate, and he has an altered brain chemistry and sensory system. What you'll see is that during a free play period in our sensory room, he became overactivated, which is very common to children from hard places. You'll see that his buddy mentors him to begin to think about regulating and takes him over to the wall, and he with another friend and their buddy are going to push the wall, called a wall push. What you'll find is that in this context, these two children with their two buddies are learning to do this deep muscle pushing against the wall. This can be done in virtually any context. By pushing deeply against the wall, we actually calm the central nervous system. Any type of deep muscle activity is called proprioception. We'll learn more about this in a later lesson. But proprioceptive activities, deep muscle activities, do two things. Number one, they calm the body biologically, and then profoundly, they release a chemical in the brain, serotonin, that you will remember has a deep deficit in children from hard places. So in this very brief example, you will see illustration that includes all three parts of the attachment cycle from the last lesson. The first part is that they're developing trust and self-worth and self-efficacy in the context of relationship. The second part is they're actually evoking the parasympathetic nervous system for calming. So they're actually evoking a biological system. And at another level, they're actually evoking a balance in their brain chemistry, bringing about a release of serotonin, which is the foundation for mental health. Is that
Whoa!
One more time.
Whoa!
I know you all worked up, so we're gonna do some wall push-ups. You ready?
Come here.
Let's go get the wall. Come on, guys.
Push. 2 hands.
Come on, Zach. We need some help, buddy.
Two
we need a
hands,
lot of
Zach.
help, please.
2 hands.
Please. We need...
Come on.
Okay.
Focus
there
on
we
the
go.
wall. Focus on the wall.
There we go. Good job. Please. I know. I see you two, but let's get this wall down.
Push. Come on, Zach.
Just like
Use
that
those hands.
dude came out. Push it. Push it. Push it. Come on. Okay.
The wall push is an effective tool for every environment. We've taught it in orphanages, in homes, residential treatment facilities, and some children in schools have teachers who put a target somewhere on the wall, and anytime the child feels agitated before a test or when they have a high pressure chore to do, they can go push on that target that's drawn or taped onto the wall and in essence do a wall push. Now, a tool that we use from the alert program called How Does Your Engine Run is called an engine check. You saw in the previous lesson how we would have children make their own engine plate, put their name on it, and then check how does their engine run several times a day. This is a way that we might introduce the engine plate and teach children to begin to regulate. The engine plate can be used for physical emotions. My engine is running too low, too high, or just right, as well as for emotional regulation. My feelings are too low, too high, or just right.
Whose engine's going like, okay. Whose engine's going too low? All the buddies. Okay, whose engine is going right here? All right.
So in that clip, you see a simple overview about how we might teach that skill. It can be taught in a home, at the breakfast table, in a classroom, in a facility. We often do these types of activities in a group we call Nurture Group that's also been implemented around the world in various environments. The next clip is also from a Nurture Group. It is teaching children another way.
Oh, yeah. Well, you know what? First, Miss Buddy, would you come and let me do it on your buddy first, okay?
Yes.
So here, let me show you how we do it on the buddy first, okay? So if we demonstrate on somebody beside the child, it's always feels safer. So if you'll lay down with your tummy down. Now, do you want to be a peanut butter sandwich or do you want to be a turkey sandwich? What kind of sandwich do you want to be?
Maybe a peanut butter and banana sandwich.
Peanut butter and banana. It is. Would you help me spread peanut butter and banana? So we're gonna rub it on there. We're gonna do kind of hard strokes, firm strokes, because that's proprioception, right? All right, now jelly. We better slice the bananas up and put them on there. Okay. Okay, now we're gonna put the bananas down. Oh, there's a banana piece. There's a banana piece. There's a banana piece. There's a banana piece. Now you know what we're gonna do? We got one piece of bread. I need another one. Now you know what I'm gonna do? I'm gonna put my weight on you, so you're gonna keep breathing. You can put your arms up here and relax them, or you can put them wherever they feel comfortable. And I'm gonna lean across this, and my weight's still on my body, on my shoulders and my hands, but I'm also gonna put some weight on it. We're gonna breathe and count to 10, okay? Okay. Will you breathe and we'll count to 10? You tell me if you feel calm, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How's that feeling?
Great.
Wow, I have a granddaughter who wants to do this every day, 3 times a day. 2, 3, 4, 5, 6, 7, 8, 9, 10. How you feeling?
Very
Cool. Do you want to let Buddy try with you now? All right. Are you going to be a turkey sandwich or peanut butter and jelly?
Gonna be a jelly sandwich?
Jelly?
Just
Okay,
jelly.
just jelly. All right. Well, no peanut butter, huh? Okay, cut the peanut butter, please. Okay, so if you lay down, put your arms down, take a deep breath, and would you put some jelly on, but put it on pretty firm. Yeah, I have to put it firm. And this is all proprioception, right? Calming, important for our kids. You don't have to. You can ask your buddy if you like
Enough
them.
jelly, or do you need some more jelly?
We're going to do an activity in a minute, and then, Buddy, all of these are going to be available because we're going to need it after the activity. Oh, is that everything?
We've got plenty of jelly.
Okay, you ready for another piece of bread? Here it comes. All right, here comes the bread. Now, now let's count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Woo, how are you feeling, Buddy?
Good.
You want to do 10 more, or are you done? Done, all right.
To self-calm and self-regulate called a chair push-up. This is very, very simple, and it's a lovely activity that children can do with very little attention to themselves. For example, children sitting in a chair at a movie, doing a test, who find themselves agitated or dysregulated can simply push up against their chair, as you'll see. Now, again, this activity is an activity that calms the central nervous system, brings deep calming to the biological system, as well as a release that enhances mental and emotional well-being. It releases serotonin. This activity can be repeated 2 or 3 times until all the children say their engine has come into the green zone. Here you'll see this activity.
So let's push up. 1, 2, 3, down. Push up. 1, 2, 3, down. Push up. 1, 2, 3, down.
In the next clip, we'll demonstrate with a little longer demonstration that actually gives an illustration of how to teach this skill, what we call a pillow sandwich. This is an opportunity to take 2 large, firm pillows and call them bread and let the child be the sandwich in the middle. We let the children have a great deal of voice. Remember, children from hard places often have fear issues. So we're going to do in this demonstration the reduction of fear for these kids by first demonstrating with another adult, which sort of debugs the activity and gives the child a sense that their friend was safe. Then we're going to give this child great levels of control. Would you like me to do this again? Would you like to do this with me? Would you like me to count to 10? We're also going to give them voice. We want them to know, as you saw in the last lesson, regulation comes from having a need expressed and being heard so that the need is met. When we're teaching these children of all ages this type of self-regulatory skill, it's imperative that we remember they have great levels of fear. They need to have appropriate levels of control, and we need to give them voice and honor that voice. Here you see the pillow sandwich.
Oh, yeah. Well, you know what? First, Miss Buddy, would you come and let me do it on your buddy first, okay?
Yes.
So here, let me show you how we do it on the buddy first, okay? So if we demonstrate on somebody beside the child, it's always feels safer. So if you'll lay down with your tummy down. Now, do you want to be a peanut butter sandwich, or do you want to be a turkey sandwich? What kind of sandwich do you want to be?
Maybe a peanut butter and banana sandwich.
Peanut butter and banana. It is. Would you help me spread peanut butter and banana? So we're gonna rub it on there. We're gonna do kind of hard strokes, firm strokes, because that's proprioception, right? All right, now jelly. We better slice the bananas up and put them on there. Okay. Okay, now we're gonna put the bananas down. Oh, there's a banana piece. There's a banana piece. There's a banana piece. There's a banana piece. Now you know what we're gonna do? We got 1 piece of bread. I need another one. Now you know what I'm going to do? I'm going to put my weight on you, so you're going to keep breathing. You can put your arms up here and relax them, or you can put them wherever they feel comfortable. And I'm going to lean across this, and my weight's still on my body, on my shoulders and my hands, but I'm also going to put some weight on it. We're going to breathe and count to 10, okay? Okay. Will you breathe and we'll count to 10? You tell me if you feel calm, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How's that feeling?
Great.
Wow. I have a granddaughter who wants to do this every day, 3 times a day. 2, 3, 4, 5, 6, 7, 8, 9, 10. How you feeling?
Very good.
Cool. Do you want to let Buddy try with you now? All right. Are you going to be a turkey sandwich or peanut butter and jelly?
You want me a jelly sandwich?
Jelly?
Just
Okay.
jelly.
Just jelly. All right. Well, no peanut butter, huh? Okay. Cut the peanut butter, please. Okay. So if you lay down, put your arms down, take a deep breath, and would you put some jelly on? But put it on pretty firm. Yeah, I have to put it firm. And this is all proprioception, right? Calming. Important for our kids. You don't have to. You can ask your buddy if you like
Enough
them.
jelly, or do you need some more jelly?
We're going to do an activity in a minute, and then, Buddy, all of these are going to be available because we're going to need it after the activity. Oh, is that everything?
We've got plenty of jelly.
Okay, you ready for another piece of bread? Here it comes. All right, here comes the bread. Now, let's count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Ooh, how are you feeling, Buddy?
Good.
You want to do 10 more, or are you done? Done. All right.
Now, in that clip, you'll noted that we said no soft touch. For children with sensory processing issues, soft touch is agitating and will dysregulate in most cases. So when we apply what we call the sandwich bits, we're careful to be firm. I hope that you noted how many children in the background had various self-calming objects. You probably saw several children with weighted blankets. Now, let me tell you that we're early in camp. This is the second or third day of camp with a dozen highly dysregulated children who've come from very hard places, and you'll see that considering those things, they are very calm and very still. As you teach the children this type of skill, you'll find that they become capable of far greater cognition, far greater behavior, far greater social interaction in this context. So if you noted, you would have seen, I think, 3 weighted blankets, at least 3 or 4 neck rolls and or like a lizard lap pad that would be for the weight in the lap. You also probably would have seen a number of sports water bottles. Sucking on a water bottle is also a proprioceptive activity. Again, it hydrates, but it also provides the type of sensory stimulation called proprioception that brings about calming. In the next clip, you'll see something similar to these clips that you've seen previously. You'll see a child in our sensory room on the trampoline. Now, this will be the first child that you saw in the wall push. This little boy, who has very serious trust issues because of his early history. He also has very serious dysregulation issues because of his early history and the prenatal exposure. And in addition, he has very high-risk brain chemistry. And so his buddy is going to demonstrate with him how to do trampoline. Now, jumping is proprioceptive, but the vestibular fluid in the inner ear, as you'll learn more about later, is vestibular when that fluid is bouncing on the trampoline. So some children become more calm in this combination. Some children actually become a little more elevated in their behavior. If that's the case, you're going to need to go back to the wall push and help that child calm down. Now, again, in this context, you'll see that a prime relational intervention is occurring. The young man who is intervening with this young child is going to be counting with him, clapping with him, and even dancing from foot to foot in a playful rhythm. This is that sense that the young child should have received from their caregiver. I feel you. I see you. I understand you. I know who you are. I'm watching you. You're important to me. So all of those things can occur in just a 20-second interaction on a trampoline. Here you'll see a trampoline interaction.
Go, buddy, go.
All right, you ready?
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 18, 19, 20. Good job, buddy.
Now, in the examples that follow, you will see us doing what we would call a nurture group with a group of high-risk adolescent males. These boys are living in an out-of-home placement for various reasons, all because of risks, various types. The boys were in what we call the nurture group, and I was using an engine plate to begin to try to teach them how to recognize their emotional states. What I'll teach them is one of the methods of calming is called affectionately by our children the magic mustache. It is in fact pushing a pressure point on over the lip right under the nose and then holding it. This can be done several times to the count of 10 until the kids that you are serving report that they're feeling calm. Again, this would be co-regulation because I am there with them, teaching them. You will find that the kids do these things very quickly on their own within a few trials of being taught by an adult. Here you see a pressure point called the magic mustache.
3 things I can think of right offhand that we do to calm ourselves, okay? One is deep breathing. One is there's a pressure point. Have y'all ever been really upset and you went like this? You're thinking about a test and you go, oh man, like that? There's a pressure point right here that you're calming yourself and you don't even know you're doing it. So put your finger here and press like, we're going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
So in that clip, what you would have seen is these young men practicing self-regulation. Now, the unit manager reported that within a few days of this 40-minute playful time where the kids were learning regulation, that he saw these young men using several of the techniques that we taught them. If you have been trained in a violence reduction system, any of those that teach you how to escape a bite or hold or prevent harm to a child who is violent against himself or against others, you will have of interest been taught to take your finger and if a child has a bite on you and has teeth into your musculature, you'll have been taught to take a finger and to rub that very pressure point, because if you rub that pressure point on a child who has teeth in your arm or teeth into your shoulder, they can't not relax because it is such an effective pressure point. This is again something kids can do in class. No one needs to know they're calming themselves when they're upset about something that's going on emotionally or possibly about an activity in class that is alarming for them. Finally, you'll see the engine plate used again with these teenage boys, one child 14, but most of them 16 to 18. And what you'll see is that we're practicing deep breathing, where they breathe deep into their abdomen and then calm themselves. Again, we would ask the children and adolescents that we serve to repeat these activities 2 or 3 times until they actually felt themselves become regulated.
So what's one thing that we can do to calm?
Take a deep breath.
Yeah, we can take that cleansing breath first, like, and then let's breathe just 3 deep breaths together, okay, guys? Just like we're practicing regulating. So 1, let's do 2.
For these young men, as many of the children that you may serve or children who are in your home, because they've come from hard places, being calm and being in a relaxed state may be a very frightening experience. You need to be patient when you're teaching these skills. For some children who've come from harsh experiences and harsh, hurtful backgrounds, or even very stressful pregnancies where their neurochemistry is on high alert all the time, it may be a deep belief of this child that if they become calm, they will be a target for a predator. That very likely has been the case in some of the highest risk children that we serve. There are other simple activities that can be done that are things like sweet tastes that are calming. Chewing activities are calming. Sweet scents are calming. These are things that can be carried in a backpack by a child who needs them. Bubblegum, Tootsie Roll Pops that can be sucked on, gobstoppers that are low in sugar and can be sucked on for proprioceptive activity. We also take, for example, old film canisters from camera film, and put pieces of cotton in them and drop, for example, vanilla oil, which is a sweet scent, and children can pull that from a backpack or from their desk or their drawer at home and smell those scents that are sweet and they're calming. By the way, if you have a student who has trouble not getting calm but getting alerted, the opposite is true. For those kids, we would have alerting tastes such as warheads or sour tarts, that sort of thing, and we might have, instead of a calming sweet oil like vanilla oil, we might have a sweet orange oil, which is an alerting scent because it is an orange scent that is high alert. In all of these ways, we are able to partner with the highest risk children and adolescents in teaching them to learn regulation skills. Children who have not come from hard places benefit, but children who have come from hard places, for them, in order to be successful in the classroom, in the home, in social interactions. Learning to regulate in the context of a loving, safe, caring environment is an absolute essential for success.